an ultimate global podcast. Hello, and welcome to our special weekly podcast on trending international and social affairs. You're listening to Saurabh Kora and George Mavros from Sydney.
So, with regards to things like cancer treatments, heart surgery, brain surgery, major operations, how accessible is health service to the average person in Pakistan?
By average, you mean people in urban centers or rural centers?
Throughout the population.
So with
So
rural centers,
the wealthy in any country will always be looked after because the wealthy make sure they look after themselves. But the average person,
definitely.
so for example, in Australia, I have private health cover. If I injure my knee and I need to get my knee fixed, I can go to my private physician, I can go into hospital, and that can happen within a week. 2 weeks, maybe 3 weeks with COVID. If you're in the public health system, a knee reconstruction is not considered urgent, and I have friends who have waited for a year to get that treatment. So what is the situation in Pakistan?
So with Pakistan, it's pretty much the same. But there are some hospitals, for example, like I said, there is a huge bend towards philanthropy, right? So you have a cancer hospital over here called Shaukat Khanum, which provides free service for all cancer patients, regardless. So Imran Khan, who was recently deposed, was our prime minister, who was recently deposed, did come up with this hospital, right? And there are other hospitals like this but not on the same scale, but they are popping up in that sense, right? So, but mainly in terms of quality healthcare, the sort of problems that you talked about, we have one hospital over here which is known as the Aga Khan Hospital, right? And that's in Karachi. So, Karachi, which means Sindh. I'm in the province of Punjab. And so we don't have a lot of hospitals like that. We have 1 or 2 hospitals. But what we do have is philanthropy, honestly. I mean, if someone appeals for that sort of thing, one of the things that Imran Khan did when he came over, he's been deposed now, I don't know if you heard about it, but he did come up with a health card, which was essentially giving around 10 lakh rupees to every household on the lower socioeconomic stratum, right? They could avail that. Now, when he was deposed, that sort of went away, except for one province of Pakistan, which is Khyber Pakhtunkhwa, KPK. That's still happening over there, right? So there is people really want to help out other people over here. This is a general climate, so to speak, over here, right? And so it's really about how we do it in a way which is internationally acceptable, right? Considering sort of medical science that's happening these days. But in terms of, again, you're absolutely right. Most rural people in the rural area or in the lower socioeconomic stratum are unable to afford such services. That is still a huge issue. But again, there is no health insurance model over here as well, right? So it's very hard for us to have companies over here who do that. So increasingly, that is why I'm looking forward to health tech coming in. You have insurance tech as well. All of these things can really help in terms of making this better, because it's not like there's an absence of will over here to help these people out. We already have precedents, like I talked about the Shaukat Khanum Hospital, or how excellent the Aga Khan Hospital is. I mean, I think you can get international level and cheaper surgeries over here as compared to in Australia or America, right? Generally, healthcare is not as expensive in Pakistan as compared to first world countries, and it can, again, if you're wealthy, you can easily avail good quality healthcare over here. And a lot of people, while I did say brain drain, but people do come back over here to Pakistan. The only issue is that how they adapt in this atmosphere, right? Because it's just a very different ball game, so to speak, as opposed to people working outside. No matter in what sector, our culture and climate, social climate is as such that nothing can be. It is hard for things to be nurtured over here. So we have a lot of brilliant ideas, but it just gets suppressed because the government decide is changed after every before the end of their term, right? They can't even get a 5-year full term. So our policies are great, our constitution is great, everything is great. It's just that there is no consistency in implementation, and that is what we fear will be our downfall. That is what I fear will be our downfall. Like I said, we are a young nation, and if we're not going to be provided the sort of opportunities that we need to thrive over here, we're just going to fly away. So that's essentially what's been happening, and I really hope that we do have a lot of potential in terms of quality healthcare to start happening over here, and people really want to invest. The private sector has recently really felt that with the advent of health tech, a lot of things can be done. So yeah.
Yeah, I'm just wanting to bringing in some statistics. I'm a person who loves to bring in statistics and numbers behind whatever I say, because I don't want to say anything without any numbers. So if I look at some statistics in terms of the
Sorry,
healthcare
Saurabh.
spending.
Sorry, I just wanted to correct the mistake I did earlier. I think you were the one who told me that the total population of Pakistan is around 221 million, right?
Yep.
Yeah.
Yeah, absolutely. Absolutely. So I'm just looking at the numbers here for 4 countries. I'm looking at Pakistan, India, Australia, and US. So their healthcare spending as a percentage of their total expenditure, total budget expenditure. If I look at Pakistan's recent investment in their budget, which is 3.38% of their total budget. If I look at India, they invested 2.1% of their overall budget into healthcare. Australia invested 10.2% recently into their healthcare budget, and United States invested 19.7%. Now, when I'm looking at healthcare spending, I'm also looking at how much of this healthcare spending is actually reaching out to the people. So to check out that, if we check the corruption perception index from the Transparency Index website, you can understand the ranking of those countries, how corrupt or how transparent are the governments there. So in that, Australia ranks the best at number 18. United States ranks at 27. India ranks at 85, and Pakistan ranks at 140. Now, this tells a lot of story to me in terms of the willingness of the government to take healthcare as a priority. I can understand that defense is a priority for India and Pakistan, but again, healthcare is equally important. And I think that's
If
where,
not more.
Faizan, you said that if the government is not coming into play, what are the other stakeholders? But I would say that if we are looking at the 3 A's, and what are the 3 A's for healthcare? You have accessibility, you have affordability, you have availability. Now, if these 3 A's are to be catered to the poorest of the poor in a country, they can only be catered by the government, because wealthy people can be taken care of by themselves. They already have the money to go to the private hospital and do all the surgeries. The government has to play a major part, I feel, in this way, to kind of invest and increase their expenditure towards healthcare, so that you have better beds for the poor people. You have more things available and affordable for the poor people, isn't it, George? I would love to know your instance in this as well.
Yeah, look, there's always it's always interesting when people quote percentages of budgets spent on something. It's a percentage of money that's allocated to that. Does it actually get anywhere? Um, uh, our Australian government has spent a lot of money on flood mitigation and disaster mitigation. We've just come through in Sydney and New South Wales in general some horrendous floods, which makes you wonder, well, where did that money go? So, and I think how much of the money actually finds its way to the people in your country, Fazan. So, and where is that money being spent to what level? Um, for example, you were saying that you have a lot of ambulances. Great, we've spent a lot of money on ambulances, but we have no people to put in the ambulance. So what is the value of that? But we can all say, oh, we've put this amount of money in, and we have this same problem in Australia. Victoria has many ambulances, and but we don't have people that can look after people in hospitals in Victoria. So it's always an interesting conundrum.
So I
And
guess you're
I don't think governments necessarily have to be corrupt for it to not work. Um, um,
very true.
Sadly, they can just be bloody inefficient.
Yeah, and incompetent. Um, so, do you want me to talk about just the budget and how it's not been? We don't think it's trickled down into the right investment corners. That's been a post-colonial legacy for Pakistan since 1947. I mean, to assume that Pakistan is just a corrupt nation with people at the top is one of the biggest fallacies I have come across. It doesn't historically take into the fact that when Pakistan was being formed, there was practically no bureaucracy over there as compared to India. There are a lot of historical factors which have shaped healthcare over here today. Colonization as a whole for post-colonial states has been extremely, it wasn't just about resources, right? If you look, then that is what social medicine is about. A generation after that, if you get to go down 2 generations post colonization, you see that people are more prone to diabetes, are more prone to heart diseases. So, and what happened in colonization, essentially famines, resources were plundered completely. There was a lot of psychological abuse, there was a lot of identity segregation. All of these things have not been dealt with and are within our legal and regulatory frameworks, right? Those things really inform how we're corrupt today, right? We haven't been able to have a democracy to make to make direct democracy, which goes trickles down to the grassroots level and is able to help us represent those sort of people who can get things done. So I really think that while obviously there is a certain part of us being corrupt about it, but it is really also what global forces shaped us today. So in spite of the fact that India had a better bureaucracy and everything, and they have a bigger population as well, which comes with merits and demerits. When it came to COVID, we saw what happened, right? Whether we had a corrupt government or not, we still ended up being better than a lot of people, right? And so what I'm trying to say is that if we've been corrupt for the longest time, that doesn't mean things haven't been working out, right?
No.
If you have corrupt people over there, you learn to deal with those corruptions. Now, when we can talk about how it needs to be completely perfect and it needs to be eliminated. I'm not someone who's saying let's be pro corruption as well. But what I'm also advocating is that I can't give you a system with which has nothing as opposed to a system which is doing something, right?
Yeah.
Even if that something is really bad, right? And just it's very important to understand that Pakistan, I there is not one government which I have seen has gone through a full 5 year tenure in terms of uh, being able to make necessary changes. There have been military dictatorships. There have been so many other things, global factors as well, geopolitical factors, which in the end we have military taking most of the chunk of the budget and in the least of it going to healthcare, right? And
Yeah.
it must be said, while I might be saying, oh, there were external people who plundered us, and that is why no, there were people complicit within us, and there are governments, the structures that we have, the people who are leading these structures, are reenacting that colonial legacy. They're exactly behaving like how other people behave with us. They're just behaving with their own people this way, right? So I'll just give you before we, even though we're talking about healthcare, but I just want to talk about the pervasiveness of this colonial aspect over here. If you go to any elite housing society over here. When you're building a house, there is always one extra room built, whether on the top or at the back, as a servant quarter, right? For people of the lower class to come and stay with them. This is exactly what happened to us when we were colonized, and the colonizers came and made servant quarters for brown people to go into. And so these things are very relevant still today. All right, it's just that the faces have changed, the values have not. It's in our education system, it's in our healthcare system, it's in our army. This is a We might think that, oh, we're just prone to military dictatorships, but this is a colonial legacy. Look at Egypt, look at practically any Muslim country and see the role of the military over there, right? And I really think that that's simply because there is no other organization, and by organization I mean someone like a group of people who can be consistent and follow protocols. There is no other organization which we can count on apart from the army, right? And whether it's floods or all of these things, or even or even political turmoil, in the end it's always the army that's coming to save us. So having a corrupt government does not necessarily mean that there is intrinsically something wrong within people. All right, there could be elements external to us which we have not been able to get rid of, right? And we're learning to get rid of them. So my point is that this is a whole package. We can't just start working on one thing and think that, okay, we'll just increase the healthcare budget and we'll increase the accountability measures over there, therefore all the investment will go in the right places, right? Again, it's also about how these big donor organizations deal with little countries like us, right? If you look at how IMF is cranking up their rates in light of the inflation in all countries, especially in developing countries, you can see the aftermath over here in terms of that, right? Uh, these transnational bodies, were set up after World War II, right, in a certain power hierarchy, which still exists today. And I would say that if corruption is being perpetuated, part of it is simply because a lot of funds are just uh, drooling and dropping in over here without the necessary checks and balances from those bodies in the first place, right? And so it's a whole system. It's not just that this government is complicit in it. The whole global system is catered towards not allowing us to change, to become independent, to do these things for ourselves, right? So whether it's people within Pakistan and outside Pakistan, they have vested interests, and those interests don't tend to extend beyond their own selves. So that has been the essential issue. Corruption is one aspect of it. Corruption it happens in all societies as well, albeit in various degrees, right? But I don't think that in spite of that corruption, we still have low cost quality healthcare still going on over here. So just thinking on that aspect, that maybe money would go in the right places, that is, I think, just looking at in a very one dimensional way. There are
Yes.
multiple factors we
Yes.
need to look into.
And a system can be efficient or inefficient, irrespective of whether the management of it is corrupt or not corrupt.
Totally
Uh,
agree.
you know, we have a government here that, in the world scale, we're supposedly um, um, fairly comfortable with their honesty and integrity. But by gosh, I can tell you about a lot of inefficiencies within our government structures, and they're managing things. So I fully take your point that that's not necessarily the answer. There's military juntas. There's many organisations outside of the law that look after their own a whole lot better than those that are in the law. So
Definitely. And it's just really about how organized you are. So military organizations just tend to be strictly and aggressively organized, right? And that's the advantage that they have. there is no room for debate in a particular sense, and you just go through it, and that's where their efficiency comes from. Now whether that efficiency is well directed or life affirming, those are the things which we need to cater to. You can't just say just because we've reached this amount of these amount of profits, we've made the necessary change we've done. So it's a little more complicated than that, I believe.
Yep. I
Yeah.
think as we are coming close to the end of this podcast session, I would love to end up with this question to both of you as to what can be some of the key takeaways, because at the end of the day, we are trying to add some value out of this podcast episode for our audience. So, any top two or three key takeaways which both the developing and developed countries can take moving forward from here on after seeing the pandemic that we have seen in both kinds of countries? Starting from George and then we'll move to Faizan. What do you think can be those initiatives in terms of coming from the government, coming from the social perspectives, and coming from great people like Faizan who are starting something of their own and trying to create a social impact in their countries?
So for me, what I found interesting from the discussion is you look at Australia, you look at the US as two countries that are developed, and you look at Pakistan, and yet Fazan was raising the same sorts of issues that we have in our own country. And the medical system in the US is nothing to be proud of. I recently had a stay in hospital for a very minor thing. But one of the medical staff said to me, if you were in America, you would have spent $15,000 to $20,000 by now. In Australia, it cost me, I think, $1,000. So it's not just developed and emerging countries. I think the other thing is that COVID has proven that doesn't matter which country you're in, doesn't matter what the system is, things like COVID, it doesn't care. It doesn't single out any one part of society to the other. And in some cases, I think a very valid point that Fazan made. When people over in Pakistan were told stay home, they stayed home. In Australia, oh, I've got rights, and that helped spread it because nobody would listen. So, and of course, the inefficiencies. We have the story of too many ambulances, not enough bed. Fazan has the same situation over there.
Completely. So really insightful, George. Those are great takeaways, and I would just like to add to them and talk about this specialization genre, right? To think that someone who comes from abroad is more specialized and can take care of local issues. I think that is a big issue that we need to address. Uh, if someone from Pakistan is going to a higher resource setting and getting trained over there for operating in a lower resource setting, do you see the irony in that? The person is being trained to be operating in a higher resource setting, and then they have to come back in a lower resource setting to do it. So no matter what sort of training they've gone through, the latest gadgets and everything, they will find a deprivation of the same appreciative climate over there for those things. All right, they won't find the sort of protocols over there. They'll just be very disenchanted when they come back, right? And
Yep.
for that, there's no locally generated context or case studies to look into for us to set our own precedents and really look into how we should be taking our own healthcare, right? It needs, again, it's like the McDonaldization of the world. If the West is doing healthcare like that, we need to do it like that, no matter what it is, because we're getting donations and funds from the West. If we don't fall on the same template, we're not going to be getting it the next time. So when you talk about those underreporting or over-reporting of cases, right? You can obviously see what's the incentive and motivation behind that, right? So this and again, we just really need to get out of that dependency cycle. Like, the fact that we have that it's not only that the system allows us to stay dependent, but it is our own mentality as well which keeps us in that cycle, right? So locally generated case studies, people over here who are not just trained as doctors, that's also a big thing to think about. When we're entering an entrepreneurial landscape, doctors don't seem to have that sort of skill set to understand how to go about these things. Now, every day, almost every doctor is complaining that low paid jobs or there are no jobs. They haven't been given any entrepreneurial skill set to actually go into a setting and start that thing. They have an amazing skill set. Anyone would be taking, like, going to them and doing it. But obviously they've been trained a certain way. They need an environment. They can't go and build it up themselves. So multiple stakeholders, entrepreneurs, academics, intellectuals need to come together, right, and really go towards the creation of smart digital villages, right? You want a digitized world. In order to make them inclusive, healthcare is the doorway. It is the most immediate way you can convince someone of the new world that you're promising, right? You can talk about agri-tech, you can talk about fintech, you can talk about all of these things, but these things take time to show their benefits, or edtech even, right? But with health tech, you immediately respond to a crisis and you earn the trust of the community. And what happens is that you keep on doing it. And this is exactly what my organization did. I also have co-founded another organization, Saving Nine. So with that organization, we came up with this rural healthcare system, right? And so we did this for 3 years. And when the coronavirus came, the people were with us. They understood what we were talking about. We had their trust. It wasn't like we were just immediately making plans and doing that, right? We were in a way already ready for it. So working over here locally with low cost solutions, all of these things really matter for us to be able to sustain healthcare over here. It won't be the insurance model or the high tech developed situation over here, but it can get things rolling towards it. And so that's just my takeaway, that whether we're corrupt or something, we have a historical baggage to deal with in terms of that. But what we do have is a will directed towards life affirmation, and that is something which I do not see in developed countries. All right, it is an increasingly isolated and fragmentary society, and what the West can learn from developing countries is to actually learning how to come together at these points. I mean, yes, you have rights, yes, you do, but please do not infringe upon the rights of others while trying to exert your own. That's the takeaway I
Yep.
believe that the West can really get from this.
Yep. Well, thank you so much, Fazan and George, for participating in this episode. I
Thank you
see
for
that we have really gained a lot of good insights from this session, be it collaborating with different stakeholders or the impact of the social initiatives that we can see. One of the big things that I'm always a big fan of is collaborating with different people. And that's what I always say. We have a European Union, we have got an African Union. Why can't we have a union in the South Asian region where we have those trade deals, where we have those collaborations with education and healthcare? Unfortunately, we have not been able to come out of the defense mindset and the mindset that we are always acting against each other, and we are not acting together. I think the moment we change that mindset, a lot can change in South Asia, because I'm from India and you're from Pakistan, Faizan. So, there is always a need to improve our areas, to improve our regions collaboratively, and acting as an entity instead of acting against each other, because that's how, we can improve our economies there, in the developing countries, and also the developed countries here in Australia and US. The way we have been tackling those challenges, as George pointed out, that how those efficiencies and inefficiencies are there in our system here in states like Victoria, New South Wales. And I think you have rightly pointed out that those examples of floods that we have recently faced, and we didn't have any answers to that. There were lives lost in that. We were not able to come up with any solutions to that. Even we are very developed here. We say that we are a developed country. So
Even the
thank you so much.
wildfires were really concerning before a few years ago. They were really concerning, and how they were like completely burning everything in Australia. And it's really important to come together. Thank you, Saurabh, for inviting me, and thank you, George. And in the end, I
Pleasure.
really hope that we can go towards a more collaborative model in this world, because the seeds of hate have been sowed in a lot of societies over here a few 200 years ago, and it's about time we rise above them and go to, because the next problems aren't nationalistic. All right, they're global. Whether it's a pandemic or climate change, now is the time we come together. And if we don't, then we can't look forward to a world which can regenerate any further. Then it won't. It just will start dilapidating more and more. Thank you so much, guys, and I look forward to having more conversations with you in the future as well.
This is an Ultimate Global Podcast. Hello, and welcome to our special weekly podcast on trending international and social affairs. You're listening to Saurabh Kora and George Mavros from Sydney.